I'm joined today by Jim Worthington. He is a member of the President's Council on Sports, Fitness, and Nutrition, and also owner of the Newtown Athletic Club. How has the fitness industry been affected by the coronavirus pandemic and the workplace closure orders that have ensued since then?
Well, nationally, it's been devastated, and certainly statewide, it's been devastated. They're expecting after 3 months, it could be anywhere from 30 to 40% of clubs domestically and statewide closing down, never reopening. So it's basically gutted our industry, and not, of course, just not only shutting down jobs, costing or shutting down businesses cost many jobs, and on top of that, you've got people that have sat around for 90 days and have not exercised. So it's not been good. Emotionally, physically, mentally. So it's been just the worst thing. And I've been in the industry 42 years. It's just been by far the worst thing that's ever happened to our industry.
How does Pennsylvania compare with other states in terms of whether or how fitness centers have been able to operate?
Frankly, horribly. The president came out in the beginning of, or right before May 1, said that he recommended that the health club industry be opened up on May 1. Nationwide. Approximately 30 states to date have opened up. Basically, mainly the Republican states. The Democratic states have not embraced exercise as medicine, and that wellness is a big part of getting people, keeping people well, building immunity. Frankly, chronic disease, 80% of chronic disease is prevented by exercise, good nutrition, not smoking, and limited drinking. Half the country seems to think that we're essential, and then half the country that are in Democratic states have really. I was just talking to a friend of mine in Chicago. They're looking at 3 months from now, the devastation that will cause the people in terms of illness and chronic illness and heart disease and so on and so forth. It's just devastating. So no, it doesn't stack up very well.
There have been times when the recommendations of state and federal officials have contradicted one another. As a business owner, how do you navigate that?
Well, it's tough. I mean, a good friend of mine that owns is a big part of a chain called Lifetime Fitness, Bahram McCarty, says the biggest problem with this whole thing is just not the ability to figure out when you're going to open up again. So you can't plan as a business person. I originally was told that we had to flatten the curve. And, I figured we were told it was going to be 2 or 3 weeks. Well, you plan for 2 or 3 weeks, and 90 days later, in my case, I'm out $7 million in revenue. I had planned construction during the time because I thought I would have cash flow to pay it, which was $3 million. Once we got into it, we couldn't stop it. So I had to, basically liquidate my retirement account, put everything else I had up for that I own for sale other than my business and my house, just to finance all these things. It's, and thank God I've got the means. Maybe, a lot of people don't, but unfortunately, most business owners don't have the means to do that, and they're out of business now. So it's been nothing but stress. I mean, only my faith in my members and my staff, and the fact that there's an old saying: when you owe the bank a little bit of money, they own you. When you own a lot of money, you own them. I owe $35 million here. So the bank's not going to let me fail because they don't want to operate my club. But the reality is that there's a big burden there, and I'm piling up debt as we speak every day. So it's been tough.
What measures have fitness centers taken to continue to serve their members remotely while everybody was on a stay-at-home order?
Well, I mean, I think it accelerated the on the internet type virtual classes. It's something that we've all been working towards. It's accelerated it, but let's be honest, nothing replaces being in a health club or in a sports setting for kids. I mean, the fact of the matter is people, if it was that easy, their health clubs wouldn't have existed in the first place. There's more to than just getting on an exercise bike. There's the camaraderie, the socialization, the mental health. I mean, I think the fact that this is a community of people. In our particular club, we've got 12,000 members. There's a reason they come here, because we are the center of the community. And every day I look out my window and a number of people come up and take selfies out the front door. They drive up with their kids and they wave through the window. I mean, this is a community with within a community. So it's had so many side effects and things that have just been devastating to people.
Now, you mentioned kids. Typically, when somebody talks about health clubs, you might think about it solely referring to adults. Does this have effects on other segments of the population, like perhaps children's sports?
Sure. I mean, first of all, I'm a member of the President's Fitness Council. So, I mean, prior to this pandemic, youth sports had decreased in the last 6 years from 45% to 37%. And it was continuing to drop. Two reasons. One, it's not fun, and two, the cost. Now kids have been gotten away from it. They project that the decrease in the last 6 years will be equal this year to the last 6 years because, again, kids have gotten away from it. Once you get sitting home and get used to being on your devices and you get lazy, it's hard to get kids motivated again. 70% of the kids age 13 stop playing youth sports at that age. So that's not only bad in a sense that it's sports. What's really important, they're not active. So, I mean, when you're not active, it leads to all kinds of other things, social issues, drugs, alcohol. I mean, just plain getting into trouble because they're just not active. Another statistic you should know, the age group 17 to 24 before this pandemic, 70% of them would fail the fitness exam to get into the military. That was before the pandemic. So that's a national security issue. I mean, frankly, exercise is medicine. What we do is essential. We should be part of the wellness community. The fact that we've been left out in Pennsylvania is a travesty. June 15th will be 3 months. I had no problem with it the first couple months. I'm a little bit annoyed it's taken this third month. Come June 15th, unless the governor has something, some encouraging words today to say about Bucks County in regards to, hey, we're closed, it's a couple weeks away, whatever. If I don't hear that today in this press conference that's going on right now, we're opening June 15th.
What guidance have you been given regarding health clubs that are starting to be in the green phase of reopening? What kind of protocols do you need to follow to open safely?
Okay, well, first of all, I'm glad you asked that question, Francine. Our club, my club, the Newtown Athletic Club, in coordination with my employees, basically set the standards, not for my club, not just for Pennsylvania, not just for the domestic industry, the entire global industry. We, through my relationship with the Surgeon General, Jerome Adams, and his ability to get us through the CDC in Washington, we accumulated information in April for the entire industry to put together in a plan that we submitted to the CDC, who worked with us to approve it and to make it as good as you can be. We then distribute that throughout the entire industry through an organization, IRSA, which is the largest trade association in the world, which I was the chair of last year, and I'm the ex officio. So literally, we have, through this club in Pennsylvania, we have set the guidelines for the entire global industry yet. And they're extensive. They're more extensive than any other industry you can think of, because remember, we're in the health and wellness business. And, temperature checks at the front door, social distancing, cleaning, all, defogging, lighting, everything you can think of, we came up with. It's pages and pages of documents. I mean, it's just unreal what we've done. And yet I said that we've done that for the industry. And here I am, the guy that put it together, and we're sitting closed. It boggles my mind. Answer to your question, everybody that opened up in May, not one person, not one club company that I know has reported any incidents of COVID, any problem, any result of them opening up. Not one. In the entire 30 states that have been open, the clubs have been. So, here we are just, in our state where we can actually help keep people well. We're sitting on our hands, not allowing it to happen. It's just so frustrating.
Once the counties are green and gyms begin to open, how will the experience be different for members?
Well, first of all, you won't be able to, you won't have as many people come in at one time. If you have group exercise type activities, you'll have to have less people. you'll have to spread people out. But to give an example, in my particular club, it's on 26 acres, 250,000 square feet. So it's about 4 times bigger than a Walmart. We have outdoor and indoor facilities. We're the 3rd largest health club in America. For me to social distance people is easy. I mean, because I'm huge. Now, the smaller clubs, they'll have a little bit more of a difficult time, but they will be able to do it because there's going to be capacity constraints, which they will clearly abide by and honor. And because remember, we're, again, health clubs. We want to keep people healthy. This is our life work. And by the way, I just want to tell you, when I do open up on June 15th, I won't be charging my members until the governor allows us, because I don't want to hear anything about, I did that for monetary reasons. There will be no charge until the governor says that we can be open. So in that way, I'm actually protesting the fact and putting, my livelihood to the side to say, I believe so much in what I do, is I'm going to open my doors and not even charge until you tell me we can. Ironically, I will say this, in my own community, not too far, within miles of me, a number of health clubs have already opened up as early as May 23rd. And good for them. I have no resentment. I'm happy for them, but it's going to be interesting to see, because of my size and our status in the industry, whether I'm going to be singled out. I hope not, because I know a lot of people have already opened up, and I think I should be treated like everybody else.
We've been speaking with Jim Worthington. Thank you so much for joining us.
Thank you.